Hi everyone, my name is Aaron and my groupmates are Kristen, Shani, Stephanie, Brooke and Kate. Today we are going to discuss about pertussis, otherwise known as whooping cough and 100-day cough. What is pertussis? Pertussis is an infection of the upper respiratory tract. It is highly contagious, especially among family members, and it can occur in anyone. However, infants are most vulnerable to it due to the compromised immune system. Now I'm going to discuss about pertussis prevalence and mortality. Pertussis affects approximately 50 million worldwide and causes about 300,000 deaths annually. In the year 2006 and 2012, 103.1 per 100,000 were infant pertussis cases. There were 11 deaths, and 10 out of 11 deaths were under 6 months old. Pertussis is mainly caused by the infiltration of the bacteria Bordetella pertussis. As I mentioned, it is highly contagious and easily transmitted to individuals with weak immune system. Evidence tells us that infected family members are most common cause of the spread of pertussis, accounting for up to 83% of cases. Symptoms of pertussis varies from infants to adults, and its pathology is classified into 3 main phases. The first 2 weeks, the patient may suffer from mild illness and cough. The next 4 weeks, they will develop a more serious cough along with the classic whooping sound as well as vomiting. This is what the whooping sound sounds like. This is followed by 1 to 2 weeks of recovery and the easing of symptoms. In older children, adolescents and adults, pertussis may present as asymptomatic with fewer infections and can be more difficult to diagnose. The best and worst outcomes of pertussis. It's common for almost all adults to have Bordetella pertussis immunization. This results in a rapid antibody immune response and less severe symptoms, for example, cold. Whereas the worst outcome of pertussis is death due to the weaker immune system of infants. They require intensive care if they are unable to fight off the infection. If it's untreated, pertussis progresses into pneumonia and will eventually lead to death. The cheapest preventive treatment of pertussis is vaccinations. Vaccinations is free for children, adolescents, and pregnant women in their 3rd trimester, and it shows a prevention efficiency of 84 to 85% based on a Cochrane database. Maternal vaccines result in 91% reduction in pertussis in infants. The immunization program involves vaccination at ages 6 weeks, 4 months, 6 months, and some boosters at 18 months, 4 years old, and another between 10 to 15 years old. And this is highly recommended for pregnant women. One of the most common types of antibiotics used for the treatment of pertussis is azithromycin. Antibiotics are used to reduce the infectivity of patients and are thought not to be effective in altering the clinical course of the illness. As azithromycin is not an approved drug for pertussis treatment on the pharmaceutical benefit scheme in Australia, its availability is in some areas is limited. Table 1 further confirms that azithromycin is more expensive when compared to other antibiotics. Therefore, it is a relatively expensive antibiotic for patients. Both doctors and nurses play an important role in the treatment and prevention of pertussis. Doctors diagnose pertussis and then recommend and prescribe the most appropriate antibiotics for treatment. Nurses are heavily involved in the prevention of pertussis, and they administer vaccinations and are responsible for educating people about the importance of immunization. This is the end of my presentation. If you have any questions, please feel free to ask me. If not, these are our references, and thank you for listening.